from there, you know, if you cannot be treated at the major minor health centers, you can now be referred to the tertiary hospitals. The tertiary hospitals are more complicated because they offer a range of specialized health care, you know, from gynecology, you know, you name it.
The main reason why we're doing this show today, because concerns have been raised.
Yeah.
How people feel when they go to the hospital. They don't understand these things because these are complex. If I have a headache and I walk into the hospital, I just want to be treated. Exactly. I don't want to know who's in charge of it.
I think that's my second point of concern as well. As I said, studies have been done in this country about the health-seeking behavior of the population. As alluded to earlier by Mr. Njai, the Director of Health Promotion
and Education.
Often you realize that many Gambians will seek health care from the informal sector. Initially, many of them, almost over 50% or more, will seek traditional health care before coming to the formalized system. By the time we see them, in many cases, it's almost late. It's almost late.
It has gone severe.
It has gone severe and maybe it's beyond the capacity of the health system. That's a major issue. And also the fact that, you know, the Health Education and Promotion Directorate, you know, it came up as a directorate recently, but, you know, we had the unit established since in the early 70s. We've been putting out a lot of messages about how healthcare could be accessed in this country. And that's everywhere.
With regards to education, I think that's very important because if they're raising awareness, it's important for the people to understand when to go to the hospital, when to use traditional. How would you help them to understand that? Because I think it works.
When people are they are late to seek for care, automatically when they are in a critical condition, they tend to come to the health center in a frustration. They want the health doctor to see them immediately. A medical doctor seeing about, for example, 30 patients. You are maybe the 35th or 36th patient, for example, I would say. And then you instead of joining the queue, you just go to the door and say, I want you to see me.
What's the ratio, the doctor-patient ratio?
Within the health policy, we have standards. Hospitals are expected to offer, like a major hospital like the RPTH, is supposed to serve a particular catchment area. But right now it's offering services to more than 800,000 or more inhabitants. This is above, you know, the standards that have been elaborated. The standards for a major tertiary facility like that is almost something like between 150,000 to 200,000 inhabitants. Just imagine. Statistically, we've done some workload calculations on RBH and how much, you know, workload a doctor can carry. On average, a doctor can only see 25 patients at the OPD daily. Right now, in fact, this is more than doubled what they are seeing.
So we are short of medical.
Exactly. So quality will be compromised, whether you like it or not. This is the matter of fact. So the other thing is, if you look at the average utilization for outpatients alone, it's almost around 800 and something.
Wow.
You know, just for OPD services alone, that does not include, you know, the maternity, that does not include the theater, that does not include all the services. So what we are now seeing is that the health system is being overworked, is being overloaded. I think people need to understand that. And the ramification of delays in services, you know, these are the impacts we are seeing right now. And that's why, you know, in English, they said prevention is better than cure. Yeah. So within the health policy, we're trying to promote, you know, and, you know, sort of put up a lot of preventive strategies, how people can basically recognize disease conditions and take preventative measures, you know. But I think this is not well taken. That's why recently the ministry and government thought it wise to put up a new directorate for health education and health promotion. And that's why we are going to put a lot of investment, because quality care is very expensive. And there's another issue, Ramatullah, if you want me to come back to that. I know you have some burning question. The other dimension is about health financing.
Yep.
And I think we need to enlighten the average Gambian as to how much effort government is putting in terms of financing health service. Health is one of the most expensive businesses you can ever think of. Of all these 22 sectors or more, health is the most expensive. It's complex. You know, you think of the equipment, you think of the trained manpower, the specialists we bring to bear to make sure that we achieve, at the end of the day, quality health care will require a lot of resources. And human resources is key.
Government face problems with regards to healthcare, insurances and things like that. But then in the Gambia, as small as we are, there are people who need these services. They need the attention and everything. But we did a street interview. We asked the general public, few people, how they feel about the healthcare system. We'll take a look at that and then we'll be right back.
So loolu di dox song yi nii dinañ si kontaan trop pour tontu leen suñu health care bi nag loolu da ngeen si dimbale dinañ si kontaan trop waaw dinañ si kontaan because of xam nga nit ki doo mën a dem without health so doo health di nga dee am lu nekk daal mooy yëpp daal so doo leen comme loolu si jógee di si jéem a dugg ni di si dox daal dinañ si kontaan dinañ si trop waaw kontaan dinañ si trop because foo dem di nga gis ñu baax ak ñu bon waaw because hospital bi dëgg la sometimes nga dem tase fa nurse yoom dañ actif sometimes nga dem tase fa am ñoom ne nii dañ teyal léegi-léegi nga gis patient bu toog sax ñu war ko attendre duñ ko attendre because man exemple man coach la maa ngi amee team damay daan di su ma pilee dama na mu 5 o'clock ma yóbbu ko hospital toog na si bed bi noonu ak tànka bi mu ngi jóg ba si éleksi lañ ko soog a mën a laal xam nga lii façon jafe-jafe yóbbu naa patient tamit ma àgga rek nurse gis ma si yoon wi nii lan la patient nii ak lii mu attendre ko so foo dem rek xanaa place liggéeykaay boo dem rek noonu la di nga gis fii ku baax di nga gis fii ku bon foog naa ne daal jafe-jafe fu nekk la daal waaw fu nekk la waaye tam doo ko mën a xee ba nga xam ne ni ñoom ñëpp ñuy dimbale ñëpp daal moo gën daal.
ni ma gisee Gambia ci wàllu health alhamdulilah mu ngi dem bu baax ndax lopitaan yi bari nañ ñu ngi faju bu baax rawatina fii Jammeh Foundation bi nekk Kanifing te ñu ngi toppatoo ñi nga xam ne ñoo feebar bu baax a baax a baax lenn rek mooy problème mooy ne liggéeykaay bu nekk rek am na benn nit yoo xam ne dañ relax am na benn nit ñoo xam ne daal seen jikko baaxut bu boobaa nag ñooñu nañ bàyyi xel ndax ñooñu dañu yàqal département bi seen tur ndax bu fekkee ne kenn ci département bi dafa behave bu ñaaw bu boobaa dañuy jàpp ne noos yëpp ñoo ko def fekk ne du noos yëpp dëgg la am na noos yoo xam ne dëgg ñu ngi góorgóorlu ci seen liggéey bu baax a baax a baax a baax.
ndela jëloon liggéey nag noosol nag ebe doo ko walal nag waaye ni taata jee fana dula dolu bije nak ni fe ni sasara ni taata pour que la sasa tandi after legi ke riak nyami ka e ke riak nyami ela riak nya ni ay tandi na am beta sometimes e ke la problème fo no so ele ay tara kudola wala ela problème fa ke na sasa la ya fa ka da samol sometimes wol bega gele nak why anything rek sometimes dol they are working hard why mbem fa la public nak no sol ya try ya kata nim sasa to dara anytime lo tano ya try ya over them.
Sometimes you so deliver they will say that you go and lay down there you are like this, it's not nice because when the president bring people to do well, you have to do well, you have to take care of lady like you. Some people say you used to do this Marabu magazine, when you come that's why you don't know how to deliver, when you come you deliver quick, I don't know. You have to take human bill in the country, you know, anywhere in this world. Because the president we have is a good president, yeah, he like everybody. So if president allow any kind of place, it can make a hospital everywhere, even the village. So we have to take care of ourselves. If you have $1, you have to make $1,000. Yeah, but we the nurse, we go there, we take mobile phone, chat to boyfriend. Man, they are not worried. We have to care of what we have.
jërëjëf foog naa noo si soo demee si l'hôpital bi waa dañ dee teg care wat am na loo xam ne dañ ko war a improve moo nekk fu nit ñi dee toog di xaar noo si daf dee crowd trop so condition bi dee favorable pour nit ñi loolu daf dee di stop ñoo xam ne dañ feebar suñ demee si l'hôpital yi foog naa loolu war nañ ko mën a improve
But in terms of caring, they are very caring. They make sure they attend to you.
Welcome back. You heard what they say. Yen mi ñoo seetaan mbokk yi Fatou Show bi la di ñëw si